I've covered news events in Conway for almost 20 years. In that time, I've seen the city go through a lot of change. Like every thriving city, Conway has its share of growing pains. That's what this show is about. We tackle the issues that are important to the people of Conway. I tell my journalism students there are at least two sides to every story. My goal is to find the common ground. Hello everyone, welcome to this edition of Common Ground. Election Day is right around the corner, and so we're wrapping up our preview of races that are on the November 6th ballot, which is just on Tuesday. With us today we have Linda Tyler, the Democrat running for Arkansas Senate District 35, which includes basically Conway, most of Faulkner County. The Republican in this race, Jason Rapert, has declined to participate in the program, and as a policy that we set months ago, the candidate who agrees to appear gets to appear. So Ms. Tyler, thank you very much for being here with us today.
You're very welcome.
I want to jump right into an issue that we hear nationally, we hear at the state level, is the economy, is job growth. Is Arkansas better off than the nation as a whole, and how can it get better?
Certainly, I think we are better off as a nation as a whole. We were one of 4 states with a balanced budget, and we often hear, well, that's a law.
Yeah, that's a law. You don't have a choice.
That's a law. We don't have a choice. Although many of the states in the nation also have that same law, and they have ended up with a deficit. So they have those same laws, and we have been able to make sure that we continue to balance our budget. We've been lucky because we don't quite have the peaks and the valleys in Arkansas that we have maybe in other states. Sometimes that's when we don't have the peaks, that's not so good, and when we don't have the big valleys, that's really good. So we tend to be economically a little more balanced in terms of our revenues, so that helps us some. But we've also had a very conservative governor. We've had a very conservative legislature. We've made sure that as we look forward into the coming years, we work real hard at the forecast and to make sure that we don't over budget.
Right, and that's a big part of the Arkansas's budget is, I guess you have the budget, you have the appropriations. Is the money has to be there before it is spent. So what can the state do to make sure that there's enough money, enough revenue, I guess, coming in to fund the necessary programs?
Well, you know, our budget process, that we talk about it in terms of revenue stabilization, it's a 3-step process if you think about it. We have, during the budget process, we have appropriation bills, and some people get an idea of something that's good that they want to propose, comes out of an agency or it comes from a state legislator, and we all can agree, well, that's a pretty good idea. But then when it comes down to funding it at the end of the year or at the beginning of the year, we fund it during the budget process, we have to decide where in that stack of good ideas does it rank, and what's the priority, and that's the funding mechanism. And then the third step of that is we fund what we call Category A and Category B funding. Category A says, from the best of our ability for forecasting, we believe that we're going to have enough revenue in the next 12 months that we're going to be able to fund all of Category A. Now, these other ideas were great ideas, but we're not just sure whether we're going to have the funding for that. But if we do, then the governor has the mechanism in place to release Category B funding so that we can fund those other good ideas. Sometimes we talk about, you know, at every year we have a surplus. And I've heard Senator Baker describe it as, you know, our budget process is like landing a plane on a runway. The runway is our budget, and each year we come in with what we've spent, and we've got to land that plane on that runway as close to the end as possible, but never go over. And so we will always have a surplus. Sometimes that surplus is bigger, sometimes it's smaller.
Okay, well, what can the legislature do, I guess, to grow the economy, so that there is more state revenue? Or does there need to be more state revenue?
Well, I think as the needs of the state continues to grow, as the population of the state continues to grow, certainly those things like K through 12 education, corrections, the Medicaid budget, some of those things have got to continue to keep pace with the population of the state. So I believe the legislature does have a role in that, in making sure that we don't put in place burdensome regulations that keep businesses from coming into our state, that we prioritize things like education so that we'll pardon me, so that we will attract businesses to our state, and we will attract those who have already invested in our state to be able to continue to grow their payrolls. So I think there's some things we can do as a legislature, and we continue to do that.
All right, so what is key in, and let's at it from the standpoint of economic development. When you mentioned education, we mentioned infrastructure, you mentioned, you could, or even if you didn't, you could talk about tax codes, things
Sure.
such as this.
Sure.
What is key to growing the economic development within the state, whether it's attracting new businesses or industries, or persuading those that are already here to expand?
Well, I think there's a number of factors. I think one of the most important factors, though, is you've got to have a workforce that's capable of carrying out the tasks or the duties of whatever that idea is for that new entrepreneur or that business to come into our state. So we've got to make sure that we've got a workforce that is prepared for these new jobs. That is both college educated workforce as well as career and skill educated workforce. We've got to be able to ensure that. As we've continued to make investments in education, we've seen those jobs come into our state. We've been able to grow jobs in our state over this really tough period of time, even when other states have not, I think because we've continued to make those investments. So we've got to do that. We also, though, I think we have to have an environment where we encourage entrepreneurship. We encourage, if you look at some of the biggest companies in our state, they started right here. I've spent 20 years at Axiom. They started right here in Conway because people had good ideas and the state supported them in those good ideas, either through incentives or through helping prepare the workforce for the technology that comes along. I just think we have to have a business-friendly environment, and I think Arkansas generally does that.
Okay, and you mentioned higher education, and this is the disclaimer. I'm employed full-time at UCA, but a higher education budget, you talk to college administrators, it's flat. We're not getting any more money from the state. Higher education costs are going up, which means tuition is going up. So is there more money for higher education in the future from the state government?
Well, David, we have, if you go back a few years, you're right. Higher education has stayed flat, and as a percentage of the cost to the universities or the colleges, state revenue has gone down as a percentage, except this last session we were able to, especially with Category B funding, we were able to provide some increases to higher education.
But as you said, Category B that's the iffy money.
That's the iffy money, right. That's right. But we had decided that was a priority for us, and that should that money come along, that's where we wanted to make sure that we invested that. We've also had, and you're aware of this too, I'm sure, this complicated funding formula for higher education. And we've had UCA, for example, has not been able to realize even based upon the funding formula, all the dollars that the state should be investing at UCA. I think they've gotten less than 75% of what the identified needs are through that funding formula.
Right, but and that's the situation. UCA's percentage may be lower, but basically the situation at every state university, right? Maybe one is close to that, what is the state level, but most are below.
Well, that's true. Most are below. But when you look at that funding formula in the past, it's been very complex, but it's also protected some institutions that haven't had the growth and haven't had the benefit of the growth, and we've protected those at the expense of those 4-year and 2-year institutions that have grown and haven't been able to realize additional revenue as a result of that. We've also then stepped back and said, well, how should we be funding our 4-year and 2-year educational institutions? Should there be some element of performance in that? And performance is how many students are they graduating, and how long does it take for them to graduate? And you've seen some shift in that funding formula. But that gets down to this total pie of dollars that we're redistributing. It doesn't talk about growing the pie. And I think you're right. We've got to figure out how do we grow the pie for higher education and make sure that we're continuing to, if we've got a goal that we want to increase the number of college graduates in our state, which we do, how do we continue to grow that pie so that we can make those investments? And we've got to do it in a smart way.
Okay. One more economic question. It's something that has kind of come out in the presidential race, but I wanted to ask about it on the state level, and this is the equal pay for equal work. Can the state take steps to ensure that women or any group is paid as much as the white man for doing the same job?
I think we absolutely can. I think that we as a state can implement not only our laws that reflect that, but we can also implement policies to do that at our state government to make sure that we're following that precept, if you will, within our own employment ranks within state government, whether it's higher education, whether it's corrections, the health department, or whatever. We've got to do that with good public policy.
Is this a problem in the state?
Well, if you say that the average woman makes 70% of what the average male for the same job makes, and that still happens in our state, well, certainly it is.
Right. Okay.
Certainly it is.
All right. Well, we're going to have to take a break, but we'll be back with more Common Ground. Welcome back to Common Ground, talking with Linda Tyler, a Democrat running for Arkansas Senate District 35. And again, her Republican opponent, Jason Rapert, declined to appear on Common Ground. Mrs. Tyler, moving into another area, moving away from the economy, I think you can certainly say the economic impact. A lot of talk about the Medicaid shortfall that is projected for Arkansas. If Arkansas doesn't do something about this, what do you see being the effect?
Well, we are projected to have a shortfall of somewhere between $250 and $400 million. And I think that number is getting closer to $250 million now rather than the 400, which is good news. But we know we've got to step up and figure out what can we do to manage that shortfall. And I don't think the answer is additional taxes. That's just not something that I'm prepared to propose, and I don't think we as a state are prepared to do. So we've got to do that through more effective and efficient delivery of services. I know that as Chair of Public Health, I've been involved in this health payment improvement group. Our Surgeon General, Joe Thompson, DHS Director, John Seelig, our Department of Health Director, Paul Halverson, we've all been, and Dr. Ron at UAMS, people have all been looking at how do we make sure we bend this curve of Medicaid costs. And we looked at certain episodes of care, if you will, and you look at some of the average cost for the highest providers to the lowest cost providers, and some of that's some quality indexes as well. Tremendous variation in that. So we've taken a look at those episodes and said, what can we do to maybe bring that together, keep improving quality where we can, and reducing costs where we can, and reduce the overall costs of the state. That's going to save us some money. I don't know that it's going to get us to the full $250 million. We may have to look at, are there certain services that we may not be able to provide as a state?
Okay, that's going to ask you. The ones who are up here at this rate, how do you keep them in the program if you start reducing their reimbursement?
Well, in fact, we don't reduce their reimbursement per patient, but the way this health payment reform effort works is to do a retrospective look at their cost on average for a large cohort of folks, and to say, okay, are you within the realm, that gap, from the highest to the lowest, and if you are over that cost, then we do expect some payment back because you have over-delivered services or you've charged the state too much for those services. So we're really not doing it on a per patient basis, but we're looking at it retrospectively over a number of patients.
And do you see this as overall, we talk about expansion of the program, more people covered, better care within the program? What do you see as being the advantages, or I guess even the effects of this approach, besides the cost savings?
I do think that part of the advantage is that you do have higher quality service. And I'll just look at one episode of cardiovascular disease, as an example of that. One of the biggest indicators of quality, and it also contributes to cost, but quality in cardiovascular disease, if someone is readmitted to a hospital after surgery within the 30 or 60-day period, that says that maybe something wasn't done. I'm not talking about not done necessarily in the hospital, but maybe the family physician or the nurse or the family were not prepared to do the things that were necessary to make sure that that whole episode of care was delivered in an appropriate way. So I think we've got to look at from the very beginning of an episode of care to the end of an episode of care, rather than the delivery of this service or this surgery. Yes. And I think that will help us in quality overall.
And do you think that there is room within this, we start talking about bureaucracy and rules and everything else, within an episode of care, the person has the cardiovascular procedure, and then within that 30, 60 days, something completely unrelated to that occurs, and this person is back in the hospital. Can that be separated?
Absolutely, absolutely it can. And there are extenuating factors that might take place. There may be some other disease that contribute to that, or other accidents that contribute to that, to your point, that may cause that cost to be much higher. Certainly there's a way to extract that from the analysis, the retrospective analysis I was telling you about, and to pay for that still as we would normally pay for that.
Okay, moving to healthcare at the national level, the Affordable Care Act. Does Arkansas need to proceed with, as Governor Beebe has said, setting up its own healthcare exchange, continuing with the steps to at least committing to do this?
David, the horse is already out of the barn in terms of being able to set up a state-run healthcare exchange. Where we are right now, though, is that we want a state-facilitated exchange. So it will have a federal exchange, but there'll be portions of it, particularly the portions where the people within the exchange work with Arkansans are Arkansans. That's one of the things that I've been very interested in, as I want to make sure that these exchanges, we keep as much control in Arkansas as we absolutely can. We don't shift that control to Washington, D.C., to the bureaucrats in Washington, D.C. I believe Arkansans taking care of Arkansans is far better. So I support what Governor Beebe is trying to do in making sure we have a state-facilitated exchange.
Do you think there will be any difference in the cost to the state with more state control as opposed to more federal control on the exchange?
That's a good question. I